Let's take a look at some examples of mitochondrial diseases. Here you can see a representation of the mitochondrial DNA, and depending on the location of the mutation, you might have different types of diseases. These diseases are quite diverse in their expression. However, for the most part, they tend to affect just about any organ because, as we just said, the mitochondrial DNA is present in every cell except for the red blood cells. So if you have a disease where you have more than 2 organs involved and maternal inheritance, then you would suspect mitochondrial disease. And these are the organs you can see, the possible involvement, and that just covers about everything. So there are a number of tests that can be done to determine potential issues, but you can have problems with the brain, the thyroid, the heart, liver, bones, muscle, and nerve conduction. So there is a very diverse expression, very diverse type of problems. One example is MELAS, which is mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. You can see here the typical maternal inheritance. What is striking here is the highly diverse presentation, and that is in different colors. You may have patients might have seizures, some may have hearing loss, diabetes, and so on. The disease is progressive and affects just about every organ. You can see here in this picture that how extensive the problems may be. And however, they are diverse, so not all patients will experience all of the signs and symptoms. Another example is LON, Leber's hereditary optic neuropathy. Let's take a look at this inheritance. You may have on the left side a carrier mother and all of the children affected. On the right side, you have the carrier father and none of the children are affected. So this is a typical maternal inheritance. Individuals with this condition, they have, with this optic neuropathy, they usually are young adult males around age 20 to 30 when they first discover the disease. And this is actually an exception because in this particular case, it's only the optic nerve affected. And so the optic nerve becomes atrophic. And what happens then, the patient is not able to see clearly anymore, as you would see on the left side, but the central part of the image becomes essentially they don't see anymore, they becomes blurred, and then they become blind. So within a year of the onset of the symptoms, 80% of the patients will be blind. However, there are many family members that might have the mutation that are unaffected. What can be done for these patients? Right now, there is no cure. However, there are some emergent therapies, such as mitochondrial replacement therapy and gene therapy. Gene therapy could be done by injecting a virus inside the eye, So this is an intravitreal injection, and the virus carries the gene that is deficient in the patients. So we talked earlier about newborn screening programs, and this is done in Nebraska for every baby who's born in the state. You can go to the website to check the list of required tests. These they tend to change. For example, there were 3 new conditions that were added on July 1st, 2018. These are all conditions where if you know that the child has the a genetic risk factor, you have the ability to intervene sooner. So these are the 3 conditions that were added: X-linked adrenoleukodystrophy or shoulder's disease, the mucopolysaccharidosis type 1, and Pompe disease. These are diseases that are one is X-linked, the other 2 are autosomal recessive. Part of the problem with these 3 conditions is that they have either fatty acids or glycosaminoglycans or glycogen, that essentially there is an inability to break down these substances, and they accumulate in the body, causing problems.